For most people with complex congenital heart disease, surgical treatment is both invasive and distressing. But a team of Sydney-based researchers believe they've found a band-aid solution to the complex issue. They're engineering mini hearts and say they offer a promising alternative to open heart surgery and transplants.
Elle Pendrick was just 3 days old when she first had open heart surgery. Born with complex congenital heart disease, it's become a routine procedure.
I've had all up 5 open heart surgeries and multiple cardiac catheters and other cardiac operations. It wasn't until I was about 22 after my 4th open heart surgery that I finally realised that I have an incurable heart disease.
Elle now faces an inevitable 6th open heart surgery. Each time she goes under the procedure, she's forced to put her life on hold for 6 months while her sternum heals.
It impacts every aspect of your life, from being able to work full time or being able to even cook and clean for yourself some days.
But Sydney heart researchers believe they've found a less invasive option, offering a band-aid-like solution, using a patient's stem cells to 3D print a regenerative patch that repairs heart damage and can be applied through keyhole surgery.
They work as the human body, as the human heart, in a way that once they're transplanted, they look like they're safe, and they're also able to improve the way the heart is pumping blood in our body.
With heart disease the leading cause of death globally, researchers hope this innovation will dramatically reduce recovery times for people who would otherwise have to undergo open heart surgery and shorten wait times for those on the transplant list because fewer people would need one.
In reality, patients that the majority of them they actually die waiting for a heart transplant. They're basically waiting on average between around 2 years.
Although intrigued, experts concede it will be some time before the treatment is available.
It's a little bit like going to the moon, and so it may be that in the future we have regenerative approaches for treatment of patients who sustain a large amount of heart damage.
Helping to mend broken hearts. Courtney Barrett-Peters, ABC News, Canberra.